Have you ever wondered what a dental filling is? Well, what happens is when you get a cavity on your tooth, there's a hole where there's bacteria. And ultimately, as dentists, we have to get rid of that bacteria so that your tooth is nice and healthy. But once we get rid of it, you are left with a hole, and that hole needs to be filled. That's the word, filling. So the traditional way of being able to fill these is with silver fillings. Silver fillings are made of silver, tin, copper, and mercury. And because of those silver fillings, they tend to be also very durable. We tend to see these lasting for quite some time in patients. Now, a major issue that we find with the silver fillings is that when we remove them for whatever reason, because of, let's say, they decay or they fail, we tend to see a lot of cracks and fractures around them. Also, they tend to be very unaesthetic. So most patients these days come to us and they're like, I don't really like the color of this silver filling inside my mouth, and they would like to have them removed. Recently, there have been more environmental concerns regarding silver fillings, and so we've seen a general phase down in terms of patients requesting these silver fillings to be done. We now find that tooth-colored fillings tend to be much more common. We will usually place them with something called composite. So these days, I find myself placing a lot more composite fillings. Composite fillings have a lot of advantages in the sense that as a dentist, when I remove decay, I can be a lot more conservative with the amount of tooth structure that I remove. This allows us to be able to conserve what teeth structures you have, and overall, it tends to be healthier for the tooth itself. Additionally, the tooth-colored fillings are obviously tooth-colored, and it helps to blend in a lot more with your smile to make you feel a lot more confident about it. So some of the disadvantages about composite fillings is that they tend to be a lot more technique sensitive. So we at Dental Designs, we take a lot of care in making sure that we can try to place them under ideal circumstances. We can often find that these fillings can get a very long life out of them, but they do need to be placed very, very carefully and with the utmost care. So there are some situations or places in your mouth which it may not be as ideal, including some of the heavy biting surfaces. So if you are a heavy grinder, for example, depending on the size of the cavity, these may or may not be suitable for you. Tooth-colored fillings tend to be more expensive, they wear a little bit faster over time, and they also can end up staining. If you'd like to find out more information, head on over to our other videos with Dr. Jacqueline, and she can talk a little bit more about those silver fillings. As a dentist, anytime that I'm putting a restoration into your mouth, really it's not a cookie cutter solution. We're really looking to your individual bite, your individual needs. In situations where you've got small fillings that are required, typically I would place a composite restoration. So the type of restoration that we put will really depend on you. It'll depend on several factors, one being cavity size, bite pressure, location, and visibility. So what would I do if I had a silver filling in my mouth? Well, if it's not decayed, broken, fractured, or there's not any other specific deterioration around it, I would leave it. So you may wonder, how do you actually care for your fillings? Well, I would definitely say the typical brushing, flossing is going to be extremely important, as you can get cavities or breakage around these fillings. Now, it is very important for you to be checked every 6 months or so, or as often as the dentist recommends, in order for us to make sure that they're actually servicing you well and not causing you any damage. Because certainly there could be something that's happening underneath the filling that you may not know, feel, may not be causing you any pain, but there still may be a reason for us to want to change that out. So come to see your dentist at Dental Designs, and we'll go ahead and make sure that you're doing okay. Thank you for spending some time with me. Bye.